would like to discuss the stress of parenting as a breast cancer patient. I am Dr. Hyewon Kim from the Department of Child and Adolescent Psychiatry at Assam Medical Center. When diagnosed with breast cancer, patients are mired in complex thoughts and emotions. These may include fears of recurrence, physical pain, changes in physical appearance, anxiety over decreased sexual attractiveness or interest, anxiety about treatment, worries about the illness, communication issues with their spouse, feeling vulnerable, and serious thoughts about death and parenting concerns. Today, I will focus particularly on the concerns about parenting. The topics I'll cover are in three parts. First, the psychological adaptation of young cancer patients who are parents. Second, whether to inform their children about the diagnosis. And third, the impact of a mother's cancer treatment on her children. First, I would like to talk about the psychological adaptation of young cancer patients who are also parents. From a very young age, humans learn and adopt roles appropriate to each stage of life, growing and evolving through these roles. Particularly from young adulthood into middle age, individuals take on significant roles both in society, meaning both at work and at home. And people contribute to the world and nurture the next generation through productive activities during this period. And parenting is one of the most crucial tasks. Recent research shows that about 14 to 22% of cancer patients have children who are adolescents or teenagers or young adults still in need of parental care. Additionally, from the perspective of children, it is reported that between 1.6 to 8.4% of children and young adults have had a parent diagnosed with cancer. This indicates that it is increasingly common for cancer patients to care for and raise children, help them with their studies, support them through college while undergoing cancer treatment. As medical advancements lead to earlier cancer diagnosis and as people tend to have children at older ages, a growing number of children, teenagers, and young adults are experiencing their parents' cancer diagnosis and treatment. A parent's cancer diagnosis introduces a great deal of uncertainty into their children's lives, starting from financial aspects. Children might suddenly find themselves in a situation where their mother, who used to take care of everything from meals, baths, homework, school supplies, to parent teacher meetings, pickups, is no longer present or consistently present. This can deeply affect a child's life, especially as they are in the midst of their own developmental stages. These changes can impact various aspects of a child's emotional, cognitive, behavioral, social, and academic development. When we meet young cancer patients with children, we always emphasize the need to consider the caregiving aspects or parenting aspects for their children. And it is something that both parents and doctors should jointly consider. When a parent is diagnosed and undergoes treatment, how would children react? Being diagnosed of cancer itself can be overwhelming and challenging for the parent, and the parent may find it challenging to fully address their children's reactions during this difficult time. It is crucial to provide support for these situations Parents must take the time to reflect on their own emotions, understand their feelings, and regulate them throughout the cancer diagnosis and treatment process. And maintaining a sense of parental efficacy, the confidence that they can still be good parents while undergoing cancer treatment, is important. It's also essential that those around the parents help them understand their child's reactions to the cancer diagnosis and help them adapt their coping strategies. Facilitating effective communication between parent and child is very important. One of the most common questions parents diagnosed with cancer ask is whether they should tell their children about the diagnosis. Well, I always say yes without hesitation. Not only in the case of a cancer diagnosis, but also when parents divorce, someone in the family passes away, or any significant event impacts the family, it is crucial to communicate with children. Even if no one explicitly tells them mom has breast cancer, they may notice a change in the household atmosphere. Things are quieter, expressions are somber, conversations are fewer, parents may cry, and there could be unusual visits from relatives or frequent phone calls. Children will realize something serious is happening and that their mother is ill. However, if adults do not provide clear information about what is happening, children might assume the situation is even worse than it is because they are not telling us. This can lead to them imagining serious scenarios far graver than reality, causing unnecessary anxiety and fear. Or children may even think that they have done something wrong, which is why they are not being told about the situation. Therefore, it's better to explain what is happening before children let their imaginations run wild with worse scenarios. Discussing cancer with children, allowing them to ask questions such as what is it, what happens next, is it going to be okay, can actually help them adapt better to the parent's illness. If a child does not express their anxiety, worries, or fears, and instead pretends everything is okay, it may lead to mental health issues or physical illness for the child. Helping children express their feelings and ensuring they feel supported by the family can enable them to cope better. Thus, it is crucial to be honest with children about this situation. This drawing was drawn by a child who attends my sessions. This child drew a house with many windows, a roof decorated with drawings, a chimney, pots on windowsills, large doors, and windows. These elements often reflect a desire to feel loved. After drawing a house, a child added a poisonous mushroom next to it and made remarks like, I hate mom and I love dad. And also, my mom was good sometimes, but she was also bad sometimes. This child came to me after the child's mother, who had been diagnosed with breast cancer, passed away. During her illness, she and her husband lived as a weekend couple, and she chose not to inform her husband or her child about her condition. It was only about a month before her passing that she finally disclosed to her husband and child that she had been receiving treatment for breast cancer. The mother passed away shortly after revealing her illness, leaving both the child and the father struggling to adapt to her sudden death and the realities of her illness. Given that the child was initially closer to the mother, her father coming home only in the weekends, her mother's sudden death without any prior explanation made the child feel as though she were abandoned. This resulted in the child experiencing ambivalent feelings towards the mother. Such emotional turmoil is why it's critical for parents to prepare their children mentally for any adverse events, including illness. Preserving the image of a loving and caring mother in a child's mind is an essential responsibility of the parent. I also emphasize the importance of open communication. Furthermore, when discussing a parent's diagnosis and treatment with a child, it's vital that the parent first takes care of their own emotional well being before sharing the diagnosis with the child. Parents should ensure they have adequately processed their own feelings. During the process of being diagnosed with cancer or undergoing treatment, a lot happens within our own minds. It is essential to manage our emotions well so we can discuss the diagnosis and treatment with our child in a composed and reassuring manner. Having emotional space allows us to observe and understand our child's reactions, whether they are struggling, feeling anxious, or pretending to be all right. This is why I advise parents to talk when they feel they have some emotional space. I recommend not discussing these matters when you are overwhelmed, in shock, physically unwell, or have too many responsibilities to manage. As for when is the best time to talk to their children about the situation, there is no one right answer. It's generally appropriate to initiate the conversation when it seems like the children have started to notice changes and may begin asking questions. This could be when they observe symptoms like vomiting or hair loss, or when their sleep patterns, behavior, or mood changes. When it's time to discuss the situation with your child, consider choosing a time and place where your child feels most comfortable to engage in conversation. If you find it difficult to have this talk yourself, it's perfectly acceptable to involve another trusted adult or a healthcare professional to help explain the situation. Make sure to use age appropriate language that your child can understand. Children might already have some misinformation from the internet or their peers, so it's important to ask what they know and what they're curious about, and then provide clear and accurate explanations step by step. In addition to discussing the treatment, be prepared to answer questions about who will take care of them, how meals will be handled, and what will happen with their daily routines like homework. It's helpful to explain who will assist with their care during this time, whether it's an aunt or a sitter coming to help. It's important to listen to your child, acknowledge any feelings of anxiety, surprise, or worry they might express, and reassure them of your love. I would also like to talk about the impact of a mother's breast cancer treatment on her children. When a mother is diagnosed with breast cancer, approximately 30% of these women have children under the age of 18. The emotional impact on children, or especially daughters, can be significant, often experiencing stress, depression, or anxiety. Adolescence is a time when individuals seek physical, emotional, and psychological independence from their parents. However, a mother's illness can make adolescents feel obligated to stay home and provide care. Daughters, in particular, tend to be more perceptive of their mother's moods compared to sons and may feel a stronger need to emotionally care for their mother. At the same time, there is also the fear that they might themselves develop breast cancer in the future. For instance, a child whose mother was diagnosed and treated with breast cancer at age 5 while being well cared for developed depression for the first time at the age of 17. When this child was encouraged to draw and talk about their feelings, they depicted their this child depicted their family members as isolated from each other, not interacting with each other, and placed their mother at a distance in the drawing. So the child said that the child shared that since the age of 5, when her mother underwent surgery and chemotherapy, she felt an obligation to take care of and support her mother, but she neglected her own emotional needs. Once her mother got better, she then began to feel depressed. So it's important to look into the child's mind and emotions and enable them to express their emotions. Research conducted at Seoul Asan Hospital indicates that when compared to other children, there isn't necessarily a higher frequency of emotional and behavioral problems observed in children whose mothers are diagnosed with breast cancer. Thus, it seems that a mother's breast cancer diagnosis doesn't necessarily lead to significant problems for the child. However, regarding the parenting stress of a mother diagnosed with breast cancer, factors related to the child's temperament, such as sensitivity or sleep problems, seem to have a greater impact on parenting stress than the actual diagnosis or treatment of breast cancer. Nevertheless, even if there are no signs of depression or other behavioral disorders, it doesn't mean that the child is not undergoing any psychological challenge, so it's still important to pay attention. To summarize my point, in the case of breast cancer patients who are raising children, it's important to consider the parenting aspect. Regarding the diagnosis and treatment of breast cancer, it's necessary to explain it to the child honestly using age appropriate language. While a parent's breast cancer may not significantly affect the child's emotional and behavioral problems, there is a need to assist with the child's psychological adaptation.